Dr. Miller-Meeks from Iowa.
Thank you, Mr. Chairman, and I thank the witnesses for testifying before the Select Subcommittee today. It's no secret that the World Health Organization failed during the early phases of the COVID-19 pandemic. Our leading World Health Agency ended up being manipulated by the Chinese Communist Party and used to dilute transparency and accountability, especially when it came to investigating the origins of the coronavirus. And since the beginning of 2021, I've stated the origins were necessary to understand because of immediate disclosure of potential pathogens, because of biosafety lab work being done in the appropriate laboratory setting, and for the ethics of certain types of research, such as gain-of-function research. As a physician and a former state public health director, I value public health and both the mission of the World Health Organization, and it's done good since its creation in 1948, since eradicating polio or smallpox in 1980 and working to reduce polio cases worldwide. However, previous achievements cannot be used as a cover for undeniable and costly failures during the COVID-19 pandemic, especially when the United States has historically been the WHO's largest contributor. During the pandemic, the WHO constantly and adamantly praised China's leadership, delayed calling it a pandemic, and acknowledging human-to-human transmission, while many of us in the public health community were saying exactly those things. And it's clear evidence that the Chinese Communist Party was lying to world leaders and restricting international access to its labs and information. The CCP was given full access to the WHO's COVID-19 origins report before it was published. The Wall Street Journal reported that the WHO-led team sent to investigate COVID-19 origins had little power to conduct a thorough independent investigation during that trip. And China initially resisted international pressure for an inquiry and later imposed strict limitations, secured China veto rights over participants, and expanded its scope to encompass other countries. As the WHO seeks to alter international health regulations, it's vital that the United States and other member countries not let bad actors hijack the review process. Similar to how the CDC lost public trust during its actions during the pandemic, the WHO has accomplished the same, but now has the chance to rebuild its reputation. And let me just comment on several of the things you said. Dr. Gwandi, we don't want respect for our sovereignty. We demand to be respected. We demand it, especially from members who are not acting in good faith. And if we cannot be assured of our sovereignty, it is up to members of Congress to have an accord or a treaty, have congressional approval so that our sovereignty is respected. And Ms. Page, we don't choose to be transparent. The 24-hour disclosure of potential pandemic pathogens is not a choice. It is a violation, and that is where accountability comes into play. So oversight of the global bureaucracy is vital, as is reviewing investments the United States is making in global health landscape through its agencies like the U.S. Agency for International Development. Ms. Pace, in your written testimony, you state that the Biden-Harris administration is working tirelessly to ensure that WHO is effectively delivering on its mission. Do you believe that limiting the influence of the Chinese Communist Party on IHR revision process is important to ensure that the WHO is effectively delivering on its mission?
Thank you for that question, Madam Congresswoman. And yes, it's quite important for us to ensure that in these deliberations around improving the international health regulations, that they evolve in a way that serves all countries, and importantly, to your point, ensures our highest and best level of prevention, preparedness, and response. It's one of the reasons that the U.S. actually took a leadership role in calling for the revisions of the international health regulations and introduced the original 13 or handful of amendments that now other countries have also come in to say, we think this is also a good idea, and we are also willing to come to the table and have a constructive conversation about how this can be improved.
While I don't support withdrawing from the WHO or necessarily not funding the WHO, I do believe there are other ways to hold the Chinese Communist Party accountable. And one of those is whether or not they have a seat at the negotiating table for the pandemic accords and IHR revisions. Dr. Nguyen-Song, or excuse me, Mr. Nguyen-Song, Ambassador, do you believe that China was transparent during and after the pandemic, and do you think they should have a seat at the negotiating table?
Thank you, Congresswoman. As I said earlier, China wasn't transparent in its ability to report and be accountable to a serious threat that ended up costing the lives of 1 million people here in the United States and 7 million in the world. This is the worst crisis that we've faced in the last 100 years in terms of a pandemic, a respiratory disease that emerged, and it actually required more transparency, really full transparency of what happened at that time. And I don't think for the past 3 years we've had that kind of, we can say that China has been fully cooperative and accountable, both to the WHO and to the rest of the world.
Thank you, Ambassador. I have one last question for Dr. Gwandi in relationship to fraud within USAID and then the request for additional funding. However, due to my time being expired, I'm going to submit the question and ask for it to be responded to in writing. Thank you, Mr. Chair. I yield back.